In Change Your Brain, Change Your Life, psychiatrist and brain health expert Daniel G. Amen, leveraging 30 years of patient experience, offers a new, more effective approach to treating and overcoming physical, mental, and cognitive issues. Amen's approach is informed by SPECT, single photon emission computed tomography, scans, a type of brain imaging that shows a brain's blood flow and electrical activity. Through these scans, Amen found that he could identify a wide range of indicators of poor brain health, including physical trauma, toxin exposure, infections, inadequate neural stimulation, and unbalanced neurotransmitters, chemical messengers that regulate mood and cognition. He noticed that certain brain patterns seem to be associated with particular health conditions. Short-form note: SPECT scans function through a three-step process. 1. A practitioner introduces a radioactive isotope, a tracer, into a patient's bloodstream. This isotope emits gamma rays, tiny bursts of energy, while circulating throughout the body. 2. The practitioner then positions a gamma camera above the patient, which is designed to pick up the gamma rays that the isotope releases. 3. As the gamma camera detects these rays, a computer processes the data to pinpoint where the isotope was when it emitted the radiation. This creates detailed images that show areas of both reduced and increased blood flow within the patient's body. Amen realized that many people's physical, mental, and cognitive issues arise from physical damage to specific regions of the brain and their associated functions. However, traditional medical approaches don't take this into account. Practitioners typically observe and make diagnoses based on the external expression, or symptoms, of these underlying physical damages. As a result, patients' issues may be misdiagnosed and they may receive inadequate treatments. For example, a patient may report symptoms of fatigue and persistent sadness and receive a diagnosis and treatment plan for depression. While this treatment plan might alleviate her symptoms temporarily, the underlying biological condition, a brain injury causing altered mood and energy levels, remains undiagnosed and untreated. Amen asserts that the most effective way to provide long-term relief for many health issues is to treat them at the root by repairing physical damage to your brain and enhancing its overall health. We'll explore his suggested treatments for achieving this in 2 parts. In Part 1, we'll explain how nurturing 4 factors: biological health, psychological well-being, social interactions, and spiritual fulfillment contribute to brain health. In Part 2, we'll explore the unique functions of each of the brain's 5 regions, pinpoint symptoms that indicate an underlying dysfunction, and provide advice for healing and optimizing performance across these 5 regions. Balancing SPECT scans and symptom diagnoses in mental health. Amen argues that relying solely on patients' reported symptoms often leads to misdiagnoses. However, other experts note that SPECT scans, while valuable for neuroscientific research and patient diagnoses, have 3 limitations that can lead to diagnostic inaccuracies. 1. The radioactive tracer used in SPECT scans follows the bloodstream, capturing brain activity at a particular moment. This means that any temporary fluctuations, such as changes in heart rate or stress levels during the scan, could lead to images that don't accurately reflect the patient's typical brain function. Such images can misrepresent the underlying condition, potentially leading clinicians to diagnose and treat a state that isn't representative of the patient's normal baseline. 2. SPECT scans can detect areas of high or low brain activity, but may not always distinguish between healthy variability and genuine abnormalities in brain function. The broad spectrum of normal brain activity means that anomalies in one individual might be within normal ranges for another. Such subtleties demand the interpretative skills of experienced clinicians to avoid misdiagnoses and inappropriate treatments. 3. While research backs up Amen's assertion that many mental health issues stem from physical changes in the brain, this research also indicates that a full recovery strategy must address the psychological components of brain health. These components, including the patient's emotional and cognitive experiences, often elude detection by SPECT scans. On the other hand, symptom diagnosis captures the patient's psychological experience and adds essential context to the objective data from SPECT scans. Therefore, clinicians can provide more effective treatment plans by combining data from SPECT scans with patient-reported symptoms. New section. Part 1. Adopt a holistic approach to brain health. While Amen advocates using SPECT scans to diagnose the biological underpinnings of mental health conditions, he emphasizes that effective treatment plans require a holistic approach that addresses biological, psychological, social, and spiritual factors. He explains that these four factors interdependently influence your overall health, and by extension, your brain health and function. For example, lack of sleep, biological, can alter your brain chemistry and cause anxiety, psychological, leading to social withdrawal, social, and a diminished sense of purpose, spiritual. Short-form note: Amen's treatment philosophy resonates with the biopsychosocial model, a holistic approach introduced by psychiatrist George Engel in the 1970s. This model counters the traditional biomedical perspective by emphasizing that biological, psychological, and social factors are equally important when assessing and treating patients. What sets Amen's approach apart is his addition of a spiritual aspect to this model. While healthcare professionals often overlook spirituality in care, research suggests that having a strong belief system or a sense of higher purpose can significantly bolster mental health. Amen suggests that even without a SPECT scan and targeted treatment for your brain's particular issues, you can still substantially improve your brain health by nurturing these four factors. Let's explore his advice in detail. Factor number 1. Biological health. The first factor influencing your brain's health is your biological health, encompassing your overall physical condition. Amen provides 4 suggestions for enhancing your biological health and explains how each benefits your brain. 1. Nourish your body. Consume a well-balanced diet rich in essential nutrients like omega-3 fatty acids and antioxidants to promote efficient communication between brain cells and to balance neurotransmitter levels. Short-form note: experts agree with Amen's recommendations for a well-balanced diet. They emphasize the importance of healthy fats in particular, noting that omega-3 fatty acids are linked to a lower risk of certain degenerative brain diseases. Additionally, studies show a link between fiber deficiency and cognitive impairment as well, so a brain-supporting diet should also include fiber. 2. Elevate your activity level. Amen recommends regular exercise, including aerobic and strength training, to increase blood flow to the brain and stimulate the growth of new brain cells. Short-form note: an added benefit of exercise is that it increases oxygen flow to the brain, even more so when you breathe through your nose. James Nestor, Breath, explains that nasal breathing increases oxygen flow to the brain more effectively than mouth breathing. This is because the nose and sinuses are specifically designed to filter and condition the air, making it easier for your lungs to extract oxygen from it. 3. Prioritize quality sleep. Amen says that ensuring you get sufficient, high-quality sleep facilitates essential brain maintenance activities that require deeper stages of sleep, such as memory consolidation, emotional regulation, and the removal of waste products from your brain. Short-form note: other experts provide more detailed advice on facilitating brain maintenance while you sleep. Neuroscientist Tara Swart, The Source, clarifies that getting 7 to 8 hours of sleep each night helps your brain cleanse itself of toxins that interfere with its functioning, and that sleeping on your side is best for facilitating your brain's natural detoxifying process. Others specify that sleeping on your left side is most conducive to cleansing your brain because it increases your circulation and lets your stomach rest below your esophagus, which, as an added benefit, improves your digestion and reduces heartburn. 4. Safeguard against threats. Amen advises you to remain vigilant to potential threats like physical trauma, for example a blow to the head, exposure to toxins, such as lead in paint or pesticides, illness or infections, all of which can harm your physical well-being and your brain's health. Short-form note: Amen's advice focuses on known threats to brain health. For example, he suggests wearing a helmet when cycling or checking labels for known toxins in products. Neurologist David Perlmutter expands on this advice, emphasizing the importance of recognizing hidden toxins that may not immediately seem harmful but can damage your brain over time. These can include elements in your diet, such as processed foods and artificial sweeteners, or environmental factors like air pollution. Factor number 2. Psychological well-being. The second factor influencing your brain's health is your psychological well-being, encompassing your thought patterns, self-perception, and self-esteem. Amen suggests 3 tips for nurturing your psychological health and describes how each improves your brain function. 1. Exercise your mind. Challenge your brain with intellectually stimulating activities such as chess and card games to promote the growth of new brain cells and preserve cognitive function. Short-form note, Sanjay Gupta, Keep Sharp, mirrors this advice, explaining that intellectually stimulating activities make your brain more resistant to disease by creating new neural connections and strengthening existing ones. This increases your brain's ability to adapt to neural damage or other challenges, or what scientists call your cognitive reserve. In addition to playing games, Gupta recommends learning a language or doing some other complex skill that gets you out of your comfort zone. 2. Manage stress effectively. Amen advises developing a stress management program that includes mindfulness techniques, deep breathing exercises, and journaling. This prevents chronic stress from harming your brain cells. Short-form note, these mindful, self-reflective methods are effective because they help you become aware of and address your stressful thoughts. Another way to keep stress at bay is to make a conscious effort to resolve all conflicts before ending your day. Researchers found that people could keep their stress hormone levels from piling up day after day by working through arguments on the same day before going to sleep. 3. Seek mental health support. Consult qualified mental health professionals to address and manage mental health concerns such as anxiety from past traumas. Getting a handle on these issues helps maintain your capacity for rational thinking. Short-form note, research supports Amen's advice to address traumatic events, showing that trauma often causes long-lasting mental and physical health issues. Studies suggest that between 40% and 50% of trauma survivors experience anxiety and depression, and that these symptoms can last up to 20 years when left unresolved. In one study, 68% of trauma survivors reported experiencing physical health problems 5 years after the traumatic event. Factor number 3, social interactions. The third factor influencing your brain's health is your social interactions, encompassing the relationships, communication, and connections you have with others. Amen suggests that nurturing relationships with friends, family, and peers helps your brain stay active and engaged, reduces stress, and provides emotional support, all of which are crucial for brain health. Short-form note, while healthy, meaningful connections can improve your mental health, unhealthy relationships can have the opposite effect, making you feel unsafe and unloved. Before sinking time into nurturing a relationship, consider whether doing so will make you feel safe and have a positive effect on your life. Ask yourself whether the relationship makes you feel a sense of mutual respect, trust, honesty, and compassion, key elements of a healthy relationship. Amen adds that your brain will benefit even more if you build relationships with individuals who prioritize wellness, as their habits and support can positively influence your lifestyle. Short-form note, the influence of others' positive habits on your well-being may be partly due to mirror neurons, nerves that fire when you witness someone else's emotions or actions and mimic the other person's experience in your mind. Studies show that these mirror neurons can help you internalize and replicate intellectual and physical behaviors, which is why surrounding yourself with those who engage in healthy habits can make your habits healthier. Factor number 4, spiritual fulfillment. The fourth factor influencing your brain's health is your spiritual fulfillment, encompassing your sense of life's purpose and meaning. Amen identifies 2 methods for tending to your spiritual fulfillment and outlines how each positively affects your brain. 1. Contemplate profound questions. Reflect on your values, beliefs, and connections to the world. This practice stimulates neural pathways, information-transmitting networks in your brain, related to self-awareness and emotional well-being, contributing to optimal brain health. Short-form note, research clarifies that engaging in self-reflection stimulates your brain by activating at least 7 integral parts of the default mode network. 2. Engage in spiritual activities. Amen recommends practices such as meditation, prayer, or volunteer work to foster rational thinking and mental flexibility. These activities help to relieve stress and broaden your perspective on life, countering the impact of ruminative thoughts that might otherwise entangle you in self-defeating patterns. Short-form note: research shows that spirituality benefits your brain by improving stress resilience and cognitive performance. In one study, participants, category Z based on how frequently they engaged in spiritual activities, underwent various tests to evaluate their stress response, cognitive functions, and psychological health. The study found that those who regularly engaged in spiritual activities showed improved stress responses and better cognitive performance compared to those who rarely engaged in such practices. New section. Part 2. Repair and optimize each of your brain's 5 regions. Now that we've explained how nurturing 4 factors can improve your overall health, and by extension, your brain health, let's delve deeper into the brain itself to target specific issues you may have. According to Amen, the brain has 5 main regions, each playing a unique role in how you function: the limbic system, the basal ganglia, the prefrontal cortex, the anterior cingulate gyrus, ACG, and the temporal lobes. He explains that damage or dysfunction in any of these regions can lead to their own set of specific symptoms. Short-form note: according to one study, the idea that certain brain regions are linked to particular functions may be too rigid, since the entire cerebral cortex activates during most functions, not just the area associated with that function. This study also shows that brain activity isn't localized, but moves in waves throughout the entire brain. However, like Amen, many scientists argue that the brain is made up of largely independent parts, theorizing that, though the parts are connected by neural pathways, they operate with a certain degree of autonomy. Just as with improving overall well-being and brain health, overcoming these symptoms requires a holistic approach. Amen recommends a range of biological, psychological, social, and spiritual treatments to repair and optimize each brain region. In this section, we'll explore the functions of each of these regions, potential symptoms resulting from dysfunction, and Amen's targeted treatments and strategies for healing each region so that it can function at its best. Short-form note: Amen advocates getting vitamin prescriptions from his clinics based on your medical history and symptoms. However, since the prescriptions are individually tailored by medical professionals, our guide focuses on the more general ways you can optimize your brain health. Brain region number 1, the limbic system. According to Amen, the limbic system plays a pivotal role in forming and consolidating your emotional responses and memories. For example, recalling the warmth of a hug or feeling motivated by a rewarding task. Your limbic system does this by regulating emotions. It plays a pivotal role in how you experience and express emotions. Forming memories. It helps you form and consolidate long-term memories, influencing how you recall past events and experiences. Guiding behavior. It influences your responses to emotional stimuli, shaping how you react in different situations. Generating motivation. It moderates feelings of motivation, reward, and pleasure, impacting your behavior and decision-making. Fostering social bonds. It facilitates emotional connections with others. Modulating physiological functions. It regulates appetite, sleep cycles, and libido. Processing sensory information. It directly processes your sense of smell, contributing to your perception and response to scents in your environment. The limbic system, specific components. The limbic system is an intricate framework comprised of multiple components. Dissecting these components provides insights into the mechanisms that shape your experiences. Regulating emotions. The amygdala functions as an emotional thermostat, assessing threats and guiding your reactions to fear and pleasure. Forming memories. The hippocampus converts short-term memories into long-term ones and aids in spatial navigation. Guiding behavior. The amygdala processes emotions, while the hippocampus provides context, jointly influencing your reactions to various situations. Generating motivation. The nucleus accumbens releases dopamine, a neurotransmitter linked to pleasure and motivation, driving reward-seeking behavior. Fostering social bonds. The amygdala and parts of the prefrontal cortex work together to enable emotional connections and empathy, essential for social interaction. Modulating physiological functions. The hypothalamus links the endocrine and nervous systems, regulating a wide range of bodily functions to maintain homeostasis. Processing sensory information, the olfactory bulb specializes in processing smells, connecting odors with emotional and memory-related responses. Symptoms of limbic system dysfunction. If you find yourself overwhelmed with persistent sadness, perceiving the world through a bleak and colorless lens, you may be experiencing limbic system dysfunction. These symptoms align with the telltale characteristics Amen describes, including emotional distress, feelings of sadness, excessive guilt, or crying spells, lack of vitality and interest, low energy levels, appetite and sleep problems, fluctuations in sexual responsiveness, and a tendency towards social isolation. Negative self-perception, low self-confidence and heightened sensitivity to criticism. Cognitive struggles, memory lapses and issues with concentration. Sensory sensitivity, heightened adverse response to odors. Other possible causes of these symptoms. While these symptoms can arise from damage to the limbic system, health experts propose a wide range of other potential causes. The following list underscores the complex nature of emotional responses and memories, suggesting that Amen's approach of linking specific brain regions to particular symptoms may result in inaccurate diagnoses. Emotional distress may result from mental health challenges, such as depression or burnout. Lack of vitality and interest is often associated with hormonal imbalances. Negative self-perception can stem from challenging circumstances such as bullying, abuse, or social pressure. Sensory sensitivity can arise from pregnancy or conditions such as migraines, allergies, nutritional deficiencies, or specific neurological conditions. Repair and optimize your limbic system. Amen's suggestions for repairing and optimizing your limbic system region include the following treatments. Aromatherapy. Diffusing pleasing fragrances to relieve stress and promote emotional well-being calms the limbic system. Short-form note. Research supports this method. Studies measuring the impact of different scents on alpha and beta brainwaves found that inhaling essential oils such as lavender, rosemary, rose, eucalyptus, jasmine, geranium, chamomile, clary sage, thyme and peppermint lowered blood pressure, induced relaxation, and enhanced brain stability. Acupuncture. Inserting fine needles into specific points on the body can increase blood flow to the brain and help regulate your mood, thus contributing to limbic system balance. Short-form note. Research implies that acupuncture stimulation may have different outcomes on the brains of different genders due to sex dimorphism, the biological and physiological differences between sexes of the same species beyond sexual organs. According to this research, in response to acupuncture, men showed more activity in brain areas related to physical sensation, whereas women experienced reduced activity in regions associated with emotion and cognition. These findings suggest that acupuncture might be more effective for addressing physical symptoms in men and managing stress and emotional well-being in women. Repetitive transcranial magnetic stimulation, RTMS. Administering magnetic pulses to stimulate and optimize brain activity patterns, including those in the limbic system, can improve emotional stability. Short-form note. To undergo this treatment, you'll need to attend daily sessions at a clinic for 4 to 6 weeks. During these sessions, an electromagnetic coil is placed against your scalp. The coil is designed to emit magnetic pulses that stimulate nerve cells in brain regions associated with mood control and depression. While RTMS is generally safe and non-invasive, you might experience side effects such as scalp discomfort, headache, facial muscle twitching, and lightheadedness. Though rare, more serious side effects like seizures, mania, or hearing loss may also occur. Cranial electric stimulation, CES. Applying low electrical currents to enhance mood and improve emotional regulation can potentially influence limbic system functioning. Short-form note. This non-invasive FDA-approved treatment for insomnia, depression, and anxiety involves actively applying a low-intensity current to the earlobes or scalp. While the exact mechanisms of CES aren't yet fully understood, research suggests that the electrical current alters brain activity, deactivating certain areas of the cortex and altering connections within the default mode network. Neurofeedback. Using real-time monitoring of brainwave activity, to help control the brain's electrical patterns and optimize emotional balance can potentially benefit the limbic system. Short-form note: to grasp how neurofeedback works, you first need to know that different mental states align with specific brain frequencies: alpha, beta, delta, theta, and gamma. Neurofeedback tracks brainwave activity and presents these frequencies in visual or auditory forms. This means you can see changes to your brain frequencies as they occur, and therefore understand what stimuli trigger certain changes. With this knowledge, you can improve your ability to self-regulate your mental state by consciously navigating triggers and controlling frequency changes. Brain region number 2, the basal ganglia. According to Amen, your basal ganglia modulate your reactions and behaviors. For example, when you jump with excitement at good news, or your hands tremble in nervous anticipation, it's your basal ganglia integrating your feelings and movements. Your basal ganglia achieve this by coordinating motor control and inhibiting unwanted behaviors. They oversee voluntary movements, integrate feelings, and suppress undesired actions. Enhancing cognition. They contribute to decision-making, planning, and problem-solving. Regulating emotions and anxiety levels. They aid in emotional processing and mood regulation while helping set appropriate anxiety levels. Influencing motivation and reward responses. They direct the brain's reward system, amplifying motivation, pleasure, and the anticipation of rewards. Supporting habit development. They enable the efficient learning and repetition of specific behaviors. The basal ganglia in detail. Within the basal ganglia, numerous smaller components work in tandem to enable the functions Amen describes. Breaking down some of these components will help you better understand the complex processes underlying your reactions and behaviors. Coordinating motor control and inhibiting unwanted behaviors. The striatum processes signals from various brain regions, suppressing conflicting or extraneous motor signals to coordinate movements. This is crucial for precise motor tasks like handwriting. Enhancing cognition. The globus pallidus regulates the striatum, modulating which movements get executed or inhibited. This impacts your coordination between thought and action, such as planning a sequence of movements in sports. Regulating emotions and anxiety levels. The substantia nigra adjusts dopamine levels, influencing how your brain perceives and responds to emotional stimuli. For example, how you react to a suspenseful movie or your resilience in challenging situations. Influencing motivation and reward responses. The nucleus accumbens responds to dopamine released by the substantia nigra, processing information about potential rewards to create behavior-motivating feelings of anticipation and pleasure. Supporting habit development. The striatum reinforces the neural pathways associated with frequently repeated behaviors, making them more automatic. This is why, after extensive practice, complex tasks like driving become almost second nature. Symptoms of basal ganglia dysfunction. If you constantly feel anxious and nervous, predicting the worst in every situation, your basal ganglia might be damaged. These signs align with specific issues Amen details, including emotional and psychological issues, heightened anxiety, muscle tension, easily triggered startle responses, reduced confidence, excessive fear of judgment, sensitivity to criticism, a tendency to freeze and avoid conflict, and compulsive habits like nail-biting. Cognitive and fine motor impairments, memory lapses, concentration difficulties, tics, and fine motor skill issues such as poor handwriting. Alternative factors that may influence these symptoms. While the symptoms mentioned can indicate basal ganglia dysfunction, health experts suggest various other factors that might cause them. Investigating these factors may help ensure accurate diagnoses and treatments. Heightened anxiety might stem from substance abuse or withdrawal, panic disorders, or specific phobias, such as agoraphobia or claustrophobia. Muscle tension can arise from heightened stress, or from conditions like fibromyalgia or repetitive strain injury. Easily triggered startle responses might be linked to post-traumatic stress disorder, PTSD, excessive caffeine, or sensory processing disorders. Reduced confidence, fear of judgment, and sensitivity to criticism can arise from a social anxiety disorder, avoidant personality disorder, or a heightened negativity bias. Memory lapses and concentration difficulties can result from attention deficit hyperactivity disorder, ADHD, age-related cognitive decline, or vitamin deficiencies. Tics and fine motor skill issues might be due to reactions from certain drugs or from conditions such as Tourette syndrome or obsessive-compulsive disorder, OCD. Repair and optimize your basal ganglia. Amen's recommendations for repairing and optimizing your basal ganglia region include the following treatments and strategies: heart rate variability, HRV, training, enhancing the beat-to-beat variation in heart rhythm, achieved through techniques like controlled breathing, helps increase the time interval between consecutive heartbeats. This lowers stress levels, improving the basal ganglia's ability to maintain emotional stability and fine-tune physical movements. Short-form note: Bessel van der Kolk, The Body Keeps the Score, clarifies that poor HRV means your breathing and heart rate are out of sync. This negatively affects how you respond to stress and makes you vulnerable to issues such as heart disease, cancer, and depression. He says that one way to train yourself to change your breathing and thus improve your HRV is by practicing yoga. Deep diaphragmatic breathing, taking slow, deep breaths, inhaling for 5 seconds, holding in for 2, exhaling for 5 and holding out for 2, improves oxygenation and removes waste products from your brain, enhancing basal ganglia function. Short-form note: in addition to enhancing basal ganglia function, deep breathing positively impacts heart rate variability, HRV, and spontaneous baroreflex sensitivity, key indicators of the body's stress response and ability to regulate blood pressure. Improvements in both these areas can improve cardiovascular function, resulting in lower blood pressure and a decreased risk of heart disease. Hand-warming visualization. Imagining activities that warm your hands, such as sitting by a warm fire, physically increases hand temperature. This induces a relaxed state that lowers blood pressure, promoting optimal basal ganglia function. Short-form note: some Buddhist monks use a similar technique to induce significant physiological changes to stay warm in the Himalayas. They practice a style of meditation known as Tummo, which uses a combination of breathing techniques and intense visualizations. For example, contracting pelvic muscles while imagining a flame ascending from the base of the spine to the top of the head. This practice effectively increases their core body temperature, often reaching levels comparable to a mild fever. Eye movement desensitization and reprocessing, EMDR, guiding eye movements to process traumatic memories and reduce their emotional impact, helps the basal ganglia maintain emotional balance. This treatment typically requires a trained professional to lead you through the process. Short-form note: Van der Kolk, The Body Keeps the Score, suggests that EMDR promotes emotional balance by helping patients diminish the impact of traumatic memories by linking them to other, loosely related thoughts and memories. This process recontextualizes traumatic events as just another memory, something that's in the past that doesn't have power over them in the present. Brain region number 3, the prefrontal cortex. According to Amen, the prefrontal cortex oversees your executive functions, enabling the modulation of your behaviors and emotions. Examples of this include when you meticulously plan your day, manage your time efficiently, or connect empathetically with a friend. Your prefrontal cortex enables you to behave this way by guiding executive functions, behavior, and attention. It directs cognitive processes, such as concentration, decision-making, self-control, coordination, adaptability, time management, critical thinking, communication, and goal-directed attention. Regulating emotions and fostering empathy. It enables you to effectively feel and express your emotions and develop empathic connections with others. The prefrontal cortex in depth. Specific elements within the prefrontal cortex enable these two key functions. Decoding the role each of these elements plays will shed light on the intricate processes shaping your cognitive processes, emotions, and behaviors. The dorsolateral prefrontal cortex integrates and adjusts task-relevant information from other brain regions, enabling focused attention and informed decision-making in complex tasks. The anterior cingulate cortex rapidly assesses conflicts in information to prompt adjustments in behavior, promoting self-control and adaptability in response to changing cognitive demands. The ventromedial prefrontal cortex interacts with the amygdala and other limbic structures to evaluate the emotional significance of situations. This enhances decision-making, critical thinking, and communication abilities. The mirror neuron system plays a role in empathy by simulating observed emotional experiences, fostering a shared emotional understanding crucial for meaningful social interactions. Symptoms of prefrontal cortex dysfunction. If you find yourself constantly battling distractibility, struggling with impulsivity, or feeling socially anxious in conversations, your prefrontal cortex might be impaired. These issues are consistent with the symptoms AMEN identifies, including attention, focus, and time management issues, difficulty sustaining attention, impulsivity and procrastination, trouble listening, chronic lateness, and impaired short-term memory. Social and emotional struggles, mood swings, misperceptions, poor judgments, difficulty expressing emotions and controlling behavior, poor social skills, and social anxiety. Additional contributors to these symptoms. Health experts identify other factors beyond prefrontal cortex dysfunction that may contribute to these symptoms. Being aware of these factors may offer a more comprehensive understanding of the nuances influencing these challenges. Attention, focus, and time management issues may stem from attention deficit hyperactivity disorder, ADHD, obsessive-compulsive disorder, OCD, or depression. Social and emotional struggles can result from bipolar disorder, depression, various physical ailments, or experiencing traumatic events such as childhood abuse. Repair and optimize your prefrontal cortex. AMEN's suggestions for repairing and optimizing your prefrontal cortex region include the following strategies. Harmonize with Mozart. AMEN explains that theta brainwave activity is linked to increased distractibility and impulsivity. Listening to Mozart reduces this activity, enhancing focus and mood control and contributing to your prefrontal cortex functioning more effectively. Short-form note. Some researchers attribute the beneficial effects of listening to Mozart to the repetitive nature of his music. Mozart's compositions typically feature repetitive melodic lines. Each harmonic tension resolves predictably, reducing elements that could distract the listener. Advocates of this theory suggest that the highly structured nature of Mozart's music may mirror the cerebral cortex's organization. Set daily goals. Recording and pursuing daily objectives steers your thoughts and behaviors and enhances prefrontal cortex functionality. Short-form note. An added benefit is that each time you achieve a goal, you'll trigger the release of the neurochemical reward, dopamine. As a result, you'll naturally associate feelings of satisfaction with the process of setting and achieving goals, and this will make it easier to adopt goal setting as a long-term habit. Envision future consequences. Contemplating the potential outcomes of your decisions trains your prefrontal cortex to consider actions' long-term repercussions. Short-form note. Gautam Bade, The Joys of Compounding adds to this, specifying that you should make daily choices with a focus on their long-term impact on your health and quality of life, and avoid sabotaging behaviors that may harm your future well-being. For example, sticking to a budget will positively impact you in the long term by creating financial stability and alleviating stress, while habitual overspending might result in debt and heightened anxiety. Leverage organizational support. Using organizational tools and enlisting help from organized people refines your planning skills and elevates the effectiveness of your prefrontal cortex. Short-form note. You'll benefit more from this strategy if you select tools that complement your natural tendencies. For example, if you process information better when you write it down, a paper-based system might suit you best. If you prefer digital solutions or your tasks require frequent updating, try using an app. If you process information better audibly, consider using a voice memo app. Additionally, choosing tools with sharing and collaboration features will make it easier to enlist help and solicit feedback from organized people. Brain region number 4, the anterior cingulate gyrus. According to AMEN, the anterior cingulate gyrus plays a crucial role in mental flexibility and decision-making. For example, it allows you to easily shift your attention from one task to another or adapt smoothly to a new idea. Your anterior cingulate gyrus accomplishes this by facilitating cognitive flexibility. It promotes the ability to effortlessly shift attention between various topics, ideas, and issues, fostering a versatile and fluid thought process. Enhancing error detection and conflict resolution. It serves as a cognitive center for detecting errors and resolving conflicts during decision-making, contributing to improved cognitive functioning. Neural dynamics within the anterior cingulate cortex. The anterior cingulate cortex, another term for the anterior cingulate gyrus, comprises intricate neural layers. Unraveling these neural complexities will provide insight into the mechanisms that enable cognitive flexibility, error detection, and conflict resolution. Pyramidal neurons in layer V of the anterior cingulate cortex contribute to communication with the dorsolateral prefrontal cortex. These neurons adjust neural activity, supporting processes that shift your attention between tasks for flexible and fluid thinking. Neurons in the dorsal anterior cingulate cortex, DACC, establish connections with the prefrontal cortex and subcortical structures, forming a specialized neural circuit. This circuit finely tunes neural connections to swiftly identify errors, resolve conflicts, and optimize cognitive functioning and decision-making. Symptoms of anterior cingulate gyrus dysfunction. If you find yourself stuck on negative thoughts or compulsive behaviors, or struggling to adapt to changes in your routine, your anterior cingulate gyrus might be damaged. These symptoms correspond with the traits Amen describes, including cognitive inflexibility and emotional challenges, excessive worrying, intense emotional reactions to changes or disruptions, difficulty shifting focus or behavior, an inability to recognize alternative solutions, a tendency to hold on to grievances, and perfectionism. Compulsive behaviors and interactions, obsessive negative thoughts, repetitive behaviors, argumentative tendencies, resistance to cooperation, and addictive behaviors. Various other causes for these symptoms. In addition to anterior cingulate gyrus dysfunction, health experts suggest alternative explanations for these symptoms. These explanations shed light on the diverse array of influences that can shape the behavioral complexities Amen describes. Cognitive inflexibility and emotional challenges might arise from generalized anxiety disorder or mood disorders such as major depressive disorder or bipolar disorder. Compulsive behaviors and interactions can be due to obsessive-compulsive disorder, OCD, post-traumatic stress disorder, PTSD, or sleep disturbances. Repair and optimize your anterior cingulate gyrus. Amen's recommendations for repairing and optimizing your anterior cingulate gyrus, ACG region, include the following strategies. Interrupt repetitive thoughts. Recognizing and disrupting repetitive thoughts, for example by snapping a rubber band on your wrist, trains your ACG to promptly identify and disrupt repetitive thought patterns, enhancing its adaptability. Distract yourself. Becoming aware of when you're fixated on a thought and deliberately shifting your focus, for example by engaging in a different activity, trains your ACG to redirect repetitive thoughts, fostering better control. Short-form note. Mental health experts suggest that thought-stopping methods like snapping a rubber band or seeking distractions may offer only temporary relief, as they don't address the root cause of repetitive thoughts, the issue you're obsessing over. They suggest you can enhance the effectiveness of these two techniques by pairing them with comprehensive approaches, such as cognitive behavioral therapy or mindfulness, which are aimed at tackling the underlying cause of unwanted thoughts. Generate rational solutions. Recording troubling thoughts, formulating actionable steps to address them, and acknowledging aspects beyond your control train your ACG to effectively manage and rationalize repetitive thoughts. Short-form note. Tony Robbins, Awaken the Giant Within, offers a practical way to generate solutions. Ask yourself 3 problem-solving questions. 1. What am I willing to do to improve the situation? This question generates specific actions toward resolution. 2. What am I willing to stop doing to improve the situation? This question identifies disempowering habits getting in the way of resolution. 3. How can I enjoy the resolution process? This question encourages you to find pleasure in resolving the cause of your troubling thoughts and motivates you to take immediate action. Seek objective advice. Discussing your recurring thoughts or behaviors with others helps you gain impartial insights that enrich your ACG's problem-solving capabilities and encourage a balanced perspective. Short-form note: while discussing concerns with others can yield new perspectives, simply receiving advice may not help you change your thoughts and behaviors. Psychologists suggest that you're more likely to make positive changes through observational learning, seeing how others successfully manage their thoughts and behaviors. This approach makes the advice more tangible and applicable to your own situations. For instance, if you're seeking advice on countering stress, you might observe how a friend remains calm and constructive in challenging situations. Brain region number 5, the temporal lobes. According to Amen, the temporal lobes are integral to understanding language and recalling memories. For example, they help you interpret the tone of someone's voice or recognize a familiar face. Your temporal lobes enable you to do this by processing auditory information. They allow you to hear and understand sounds in your environment. Language comprehension and production. They support spoken and written language, helping you communicate effectively. Visual perception and recognition. They allow you to see and identify objects, faces, and scenes. Memory formation and retrieval. They play a crucial role in forming and recalling long-term memories, affecting how you remember experiences and events. Decoding how the temporal lobes function. Within specific areas of the temporal lobes, neurons and brain structures work collaboratively to enable these functions. Unveiling the intricacies of this collaboration will enrich your understanding of how you process language and recall memories. Processing auditory information. Neurons in the primary auditory cortex process and respond to sound stimuli, allowing you to hear and understand sounds in your environment. Language comprehension and production. Neuronal networks in the superior temporal gyrus, specifically Wernicke's area for language comprehension and Broca's area for language production, support both spoken and written language, facilitating effective communication. Visual perception and recognition. Neurons in the ventral part of the temporal lobes, including the fusiform gyrus, enable you to see and identify objects, faces, and scenes. The fusiform face area, a specialized region within the fusiform gyrus, plays a role in face recognition. Memory formation and retrieval. The hippocampus interacts with the prefrontal cortex to encode experiences into long-term memories and retrieve them when needed, influencing how you remember past experiences and events. Symptoms of temporal lobe dysfunction. If you struggle to comprehend spoken words, or fail to recognize the faces of loved ones, or often misinterpret the world around you, your temporal lobes might be damaged. These conditions are in line with the characteristics Amen outlines, including emotional challenges, aggression, negative or violent thoughts, sensitivity to perceived offenses, paranoia, emotional instability, unexplained anxiety or fear, and a tendency to fixate on religious or moral concerns. Cognitive and language difficulties, word-finding problems, challenges in processing auditory and visual information, memory issues, impaired reading comprehension, periods of absent-mindedness, and a tendency for hypergraphia, excessive writing. Sensory and perceptual challenges, abnormal or distorted visual or auditory perceptions, feelings of déjà vu, difficulty recognizing known places or individuals, and unexplained headaches or abdominal discomfort. Other potential triggers for these symptoms. While these symptoms can result from damage to the temporal lobes, health experts suggest that they can emanate from a range of other factors. The following list may help you recognize and address causes that you might not have initially considered. Emotional challenges might be due to unmet physical or emotional needs. The tendency to fixate on religious and moral concerns may be a symptom of scrupulosity, a subtype of obsessive-compulsive disorder, OCD. Cognitive and language difficulties can arise from neurological conditions, chronic ear infections, sleep apnea, or a vitamin B12 deficiency. Sensory and perceptual challenges may stem from fevers, migraines, epilepsy, sleep disorders, infections, or disorders such as agnosia or dementia. Repair and optimize your temporal lobes. Amen's advice for repairing and optimizing your temporal lobes includes the following strategies. Engage in rhythmic activities. Participating in activities like chanting or dancing helps you enter a trance-like state that fosters tranquility and open-mindedness, promoting a sense of emotional well-being that stimulates and heals the temporal lobes. Short-form note: Oprah Winfrey and Bruce D. Perry, What Happened to You, link the therapeutic, trance-like effects of rhythmic activities to a subconscious recall of the womb's security, where the mother's heartbeat was a constant presence. Another theory suggests that engaging with rhythm beneficially alters brainwaves, synchronizing them with the beat. This increases cerebral blood flow and activity, potentially improving focus and reducing anxiety. Practice toning and humming. Using vocalization techniques helps induce relaxation, release pent-up emotions, and alleviate physical discomfort. These effects enhance mental clarity, thereby aiding the temporal lobes in regulating mood and cognition. Short-form note: Sound therapists clarify that toning and humming create these benefits by elevating nitric oxide levels. This elevation promotes relaxation, mental clarity, and physical well-being by lowering stress-related markers like blood pressure and heart rate, and shifting brain wave speeds from the active beta state to the slower, more meditative states of alpha, theta, and delta. Master anger management. Adopting a 5-step approach, focusing on relationship goals, identifying your anger patterns, controlling your breathing, employing distractions, and considering the effects of your anger helps reduce stress on the temporal lobes. Short-form note: Though it might seem easier to live with anger rather than address it, it's important to process anger because it sparks aggression, an evolutionary remnant of when fight or flight were the only options to survive. In the modern day, the increase in blood pressure and adrenaline that come with anger are usually maladaptive instead of helpful, as they can damage your health and relationships.